All right, let's dive deep today, shall we? We're tackling nephrotic syndrome.
Ooh, that's a good one.
Yeah, you might know from a doctor's visit or maybe just, some late night internet searches.
Happens to the best of us.
But whatever brought you here, think of this as your crash course. Not just what nephrotic syndrome is, but those weird symptoms, the stuff you wouldn't expect, and the big one. What can you actually do about it?
Right, because knowledge is power, right?
Absolutely. So we're going to unpack why it happens, how it's diagnosed, and the strategies to, actually manage it, like your cheat sheet to nephrotic syndrome.
Love it.
And I've got our expert here to guide us through it.
Happy to be here. Always up for a good kidney deep dive.
Yeah.
So imagine your kidneys, right? Incredible filtration system.
Like constantly cleaning your blood.
Exactly. And inside are these microscopic filters called glomeruli. Their job, very important, they keep the good stuff in your blood, especially protein.
Okay, so protein stays in, but the waste goes out.
You got it. Passes into your urine. Elegant system, really. But with nephrotic syndrome, it's like these filters get clogged, start letting things through that they shouldn't.
Oh, so it's not just about stuff not getting filtered out, but good stuff leaking back in.
Precisely, like turning these careful guardians into, well, leaky bouncers, not doing their job right.
Okay, so instead of keeping the good stuff in, the kidneys are letting vital protein escape back into the urine. So what happens then? What happens to your body when that starts?
It's like losing the foundation of your house. Protein. It's a building block for so much. And when you start losing it through your kidneys, everything's affected.
Everything.
You might feel constantly drained.
Oh, so that's the fatigue.
Fatigue setting in. Your body can't regulate fluids as well, so swelling, especially your legs, face.
So you literally puff up.
And then your immune system, it takes a hit too, making you way more vulnerable to infections.
I wouldn't have guessed leaky kidneys could cause such a chain reaction.
The body's a complex system for sure.
But let's talk about those symptoms. Some of them are pretty weird, right? I mean, swelling, okay, makes sense. But foamy urine, what's up with that?
It's true, not exactly what you expect to see, but foamy urine. Telltale sign that protein is escaping.
So it's not every day you gotta explain why your pee looks like a bubble bath?
Right, definitely a conversation starter. But joking aside, it's a key indicator of nephrotic syndrome.
So we've got fatigue, swelling, the unexpected bubble bath situation,
Can't forget that one.
and then on top of it all, increased risk of infections. That's serious stuff.
It is. It all comes back to that protein loss.
Yeah.
Weakens your defenses. It's not just swollen feet, it's your body's ability to stay healthy overall.
Right, so you're more likely to get sick on top of everything else.
Sadly, yeah.
So we know nephrotic syndrome messes with the kidney's filter system, but what makes those filters go haywire in the first place?
Think of it like this. There are direct hits, and then there's like collateral damage, right?
Okay, I'm intrigued.
Direct hits, doctors call them primary causes. Conditions that attack the glomeruli directly.
The glomeruli, those tiny filters.
Those guys. So things like minimal change disease, that's pretty common in kids, actually. Then there's focal segmental glomerulosclerosis, we shorten it to FSGS, and membranous nephropathy.
So if you have kids, or are planning to, this is definitely something to keep on your radar. Catching it early is huge.
Huge.
But what about that collateral damage you mentioned?
Ah, that's where secondary causes come in. These are health issues that maybe they don't directly attack the kidneys, but they can still end up damaging those glomeruli over time.
Okay, so it's like a side effect.
Yeah, kind of. So we're talking diabetes, lupus, certain infections like hepatitis or HIV, even some medications like common ones, NSAIDs, lots of culprits.
So many different things it could be.
Makes it tricky to diagnose sometimes.
That's why it's like a puzzle for doctors, right? It's not always a clear-cut diagnosis. So how do they figure out what's causing nephrotic syndrome in a patient?
It's like medical detective work. Doctors use all sorts of tools to piece together the clues, figure out the root cause. We're talking analyzing your urine, running blood tests, taking a peek inside with imaging tests like ultrasounds.
Sometimes even a kidney biopsy.
Right, that's when it gets serious. But let's break those tests down, because I know they can sound kind of scary if you're not familiar with them.
Yeah, for sure. So first up, we've got urinalysis. More than just peeing in a cup, I assume.
Way more. They're not just checking the color, they're looking for those telltale signs of protein loss. It's like a microscopic search for clues in your urine.
Fascinating. And what about blood tests? Those go beyond just your routine checkup, right?
Absolutely. Doctors are looking for things like low levels of albumin, that's one of those essential proteins we talked about, as well as signs of high cholesterol and overall kidney dysfunction. like piecing together a puzzle. Each test result gives you another piece.
So each test adds a little bit more information.
Yep. Then there's imaging tests, like ultrasounds. Gives them a visual of your kidneys, helps rule out any obvious structural
So
abnormalities.
like they can see if something's physically wrong with the shape or size.
Exactly.
And last but not least, the kidney biopsy. I know that one can sound scary, but it can be a game changer when it comes to knowing the exact type of nephrotic syndrome someone has, right?
Not always needed, but in some cases it's crucial. It lets doctors actually examine the kidney tissue under a microscope, helps them pinpoint the specific damage and figure out the best way to treat it.
So we've covered the symptoms, the causes, and the detective work of diagnosis. But what about treatment? Is there a one-size-fits-all approach? Or does it depend on what's causing it?
You hit the nail on the head. Treatments tailored to the individual based on the root cause of their nephrotic syndrome.
Makes sense. So what are some of the common approaches? Medications, I assume.
Medications are definitely a big part of it. Doctors use them to target the specific effects of nephrotic syndrome. So for example, if swelling's a big issue, they might prescribe diuretics, help your body get rid of that excess fluid. Or if blood pressure is high and you're losing protein, ACE inhibitors or ARBs could be the way to go. And in some cases, like with FSGS or lupus, immunosuppressants might be needed. And then there are statins to manage that high cholesterol that often comes along for the ride.
Okay, so there are a bunch of different medications they could use, but what about things people can do themselves? What kind of lifestyle changes can help? That's something everyone has control over.
You're right, lifestyle changes, they're huge for managing this. And one of the biggest, diet,
So what we eat can actually impact how our kidneys function.
big time. Controlling salt and fat intake is essential. And sometimes adjusting protein intake too. Might mean learning to cook differently, making smarter choices when eating out. It's about taking charge of your health, making choices that support your kidneys.
So it's about more than just popping a pill.
It's a whole lifestyle shift.
Gotcha. So beyond diet, what else can people do?
Staying active, but not overdoing it, is key. And keeping an eye on your weight and blood pressure, those are your allies. It's not just medical advice, it's about healthy habits that benefit you in the long run.
Right, so it's a combination of medical intervention and taking charge of your own health.
Exactly. And speaking of taking charge, let's talk about prevention and long-term management.
So before we went to part two, we were talking about those underlying conditions, like keeping your diabetes or hypertension under control really protects your kidneys.
Right. But here's the thing. Even with perfect management, some folks still develop nephrotic syndrome. Like there's this missing piece of the puzzle.
So there's more to it than just those health issues.
Way more. And that's where the research gets really exciting. Scientists are digging into genetics, the immune system, trying to understand why some people are more prone to it.
Let's start with genetics. Is there like a specific gene that makes you more likely to get it? Like, could people get tested for a nephrotic syndrome gene?
If only it were that easy. No single gene determines if you'll develop it. It's more like a combo of genes, maybe interacting with environmental stuff, that tip the scales.
So it's not a guarantee, but certain genes could increase your risk.
Exactly. It's that nature and nurture thing, always so complex. And then we've got the immune system. We talked about protein loss, weakening it, right? Well, now research is suggesting the immune system might actually be involved in causing nephrotic syndrome in some cases.
Wait, so the immune system, which is supposed to protect us, could be attacking the kidneys.
That's one theory. In certain types, like minimal change disease, the immune system seems to mistakenly target those tiny filters, the glomeruli. It sees them as a threat for some reason.
So it's like an autoimmune thing, the body attacking itself.
Spot on. And that's why doctors often use meds that suppress the immune system, like corticosteroids, to treat those types. It's like calming the immune system down, telling it to chill out.
Makes sense. So you've got genetics, maybe a case of mistaken identity with the immune system. Anything else researchers are looking into?
Tons. There's growing interest in the role of inflammation. Inflammation, it's part of healing, right? But when it's chronic, long-term, it can actually damage tissues, including those delicate glomeruli.
So the body's trying to heal, but it goes overboard and ends up hurting itself.
Pretty much. And the cool thing is, some of those lifestyle factors we mentioned, diet, exercise, they can actually impact inflammation levels big time.
So those healthy habits aren't just managing symptoms, they could be addressing a root cause.
Got it. That's why lifestyle modifications are so crucial in managing nephrotic syndrome. It's being proactive, taking control through your choices and medical treatments.
Love that, empowering yourself. This research is so inspiring. Any particularly promising avenues right now when it comes to new treatment?
Oh, definitely. One that's got everyone buzzing. Targeted therapies.
Targeted therapies, what are those exactly?
Drugs that zero in on the specific mechanisms behind nephrotic syndrome. Not just treating symptoms, but tackling the root of the problem.
Like a more precise approach.
100%. Like a scalpel instead of sledgehammer. One example. Drugs that block certain signaling pathways involved in inflammation. Block those, and you could prevent the damage before it even starts.
Stop it before it happens. Incredible. What else is coming down the pipeline?
Another one that's super promising. Cell-based therapies. Sounds futuristic, but it's showing real potential.
Cell-based therapies. That does sound pretty sci-fi. What's the idea there?
Basically, using healthy cells, either from the patient or a donor, to repair or even replace damaged kidney tissue. Like giving those kidneys a boost, helping them heal and get back to work.
So you're basically giving the kidneys the tools to fix themselves.
That's the goal. And there are even trials underway right now using stem cells to treat certain forms of nephrotic syndrome.
Wow. So much to look forward to. It's amazing how far we've come with medical science.
Truly is. We still have lots to learn about nephrotic syndrome, but the research is moving fast, which gives us plenty of reason to be optimistic about the future of treatment and even prevention.
That's what I love about this field, the constant pushing for breakthroughs, finding ways to improve people's lives.
Absolutely. And even small steps, they make a huge difference for those living with this.
Well, on that note of hope and progress, we'll wrap up part 2 of our deep dive into nephrotic syndrome. But don't go anywhere, we've got more to explore. In part 3, we're going to switch gears a bit and talk about the emotional and psychological side of living with this condition. Because it's not just about the physical, it's about the whole person. Until then, stay curious, keep those minds and bodies healthy. Welcome back to the deep dive. We've gone from those leaky bouncers in your kidneys to some pretty futuristic research.
It's amazing what they're doing now, right?
Absolutely. But now we're shifting gears a bit. We're going beyond just the biology, the medical stuff. We're going to explore the emotional and psychological impact of, actually living with nephrotic syndrome.
It's so important to talk about that, too.
Yeah, it's not always something that gets a lot of attention.
Right. But it can really affect people's lives in a huge way. It's not just the physical symptoms themselves, it's how they affect your whole life, your day-to-day, your relationships, even your sense of self.
I can only imagine dealing with constant fatigue, swelling, and then that worry about infections.
It's a lot.
It's got to be a constant battle.
It can feel that way, yeah. And then there's that emotional roller coaster you get with any chronic illness. The uncertainty, frustration, the fear of what's next. Those feelings are real, and it's okay to acknowledge them.
Yeah, it's okay to not be okay.
Exactly.
And I imagine there are challenges that are kind of unique to nephrotic syndrome. You mentioned earlier that some symptoms can be pretty visible.
Yeah, like the swelling, especially in the face and legs. It can be really noticeable. And that can make people feel self-conscious, like everyone's staring. So you might start avoiding going out, being around people. And that can really mess with your self-esteem.
It's like your own body betraying you and everyone can see it.
That's how it can feel, for sure. And then there's the impact on your relationships, too.
Because it's not just you going through it.
Right. It's hard enough dealing with a chronic illness.
Yeah.
But it also puts strain on the people who care about you.
So you're trying to manage your own health, but then you've got your family, your friends, they're worried too.
Exactly. And they may not always understand what you're going through.
Yeah.
Which can lead to feeling isolated, like nobody gets it.
So what can people do? How do you deal with all of that, the emotional side of nephrotic syndrome?
Well, first things first, it's okay to not be okay, like we said. It's normal to feel overwhelmed, frustrated, even angry. Don't bottle it up, let it out.
Talk about it.
Yeah. Talk to your doctor, a therapist, a friend you trust, or even join a support group. Connecting with people who understand what you're going through, it can make a world of difference.
It's like having your own team, right?
Exactly. And don't forget self-care. Make time for things you enjoy, things that help you relax, whether it's reading, listening to music, getting out in nature, meditating, whatever works for you.
Those little things can really add up.
Absolutely.
Yeah.
And remember, there is hope. With the right treatment, the right support, people with nephrotic syndrome can still live full, meaningful lives.
It's not a life sentence.
Nope. You can manage this condition and thrive.
So as we wrap up our deep dive into nephrotic syndrome, let's recap what we've learned. Those leaky bouncers in your kidneys, the glomeruli, They cause a whole cascade of symptoms that affect your entire body. We talked about the different things that can cause nephrotic syndrome and how tricky it can be to diagnose.
We talked about treatment, too. It's a team effort, medication, plus those lifestyle changes. And the research, oh man, so much exciting stuff coming down the pipeline.
And we can't forget about the emotional and psychological side of it all. It's important to reach out, get support, and take care of yourself.
You're not alone in this. There are people who understand and want to help.
Exactly. So to everyone listening, whether you're dealing with nephrotic syndrome personally or just wanted to learn more, we hope this deep dive has given you some insights, helped you understand this complex condition a little bit better. Take care of yourselves, and as always, stay curious.